Welcome, everyone. This is Dr. Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our podcast where we discuss positive health, positive psychology, healthy lifestyles, and everything that connects around that. And so I'm delighted today to have as our guest Dr. Julie Hazlip. She is a professor of nursing and pediatrics at the University of West Virginia. Welcome, Julie.
The University of Virginia, not West Virginia.
Oh, should we start again? We can start again because I want to make sure it's
Okay,
correct.
that's fine.
No problem. I'll just have her cut this off. Okay.
I'm sorry if I said
No,
that.
no, this is what it's about. It's cool.
Okay,
I wrote it down wrong. Just the University of Virginia.
yeah.
See. Hello, everyone, and welcome. This is Dr. Lianov, and I'm the president and founder of the Global Positive Health Institute. And this is our podcast where we discuss positive health, positive psychology, healthy lifestyles, and everything related to well-being. And I'm delighted today to have as our guest Dr. Julie Hazlip. She's a professor of nursing and pediatrics at the University of Virginia. Welcome, Julie.
Thank you. It's great to be here.
Wonderful that you're taking this time out to talk to us about some of these topics and what got you interested in positive psychology and everything related to that.
Oh gosh, it's been 17 years ago now. I remember because it was right after the birth of my youngest child, and I was coming back from maternity leave, and I was exhausted, and I was trying to figure out, we had gone from 2 kids to 3 kids, so from man to man to zone defense, right? And we were trying to figure out how we were gonna make all of this work. And I got invited to an appreciative inquiry process that was happening in the academic health center where I work. And I remember walking in, I didn't really know what I was going to. Um, but I walked in and we did a discovery process, and we were talking about what it was that was really meaningful about our work and our work in academic healthcare. And I remember leaving that morning, that afternoon, um, really just more energized and inspired than I had been in a really long time. And so I said, I don't know what this is, but I've got to be a part of it. I reached out to the people who had put that on and ended up getting involved in what has now come to be known as the Center for Appreciative Practice at UVA. Started delving in, initially primarily to appreciative inquiry, but then it kind of grew into other positive psychology topics and the science, and that ultimately ended up leading me to get a master's in applied positive psychology.
So it was through your own personal experience about how you got energized from this one small area, a sub area of positive psychology, which is appreciative inquiry, which I love so much. And then that opened the door to so much else that's in this field. And so, how are you using it now professionally?
Oh, well, so now it's really kind of part of how I operate every day. I think once you kind of get into this work, it starts to permeate everything that you do. But I also am now researching the topic of mattering in healthcare. I'm specifically interested in how we create cultures of mattering in our healthcare systems so that we can hopefully prevent some of the burnout and some of the distress that our clinicians are feeling. Um, so that's it right now.
Yeah, well, I think that this concept of mattering is so important, and I know the research is early. These are early days, but when I heard about you and your work, a real light bulb came on for me. That's what I've been missing this feeling of mattering, and so then it really made me start to think about how it's different from meaning in other areas in our lives that seem similar, but they're different. So, can you explain a little bit about that?
Oh, sure. So, back in the early days of the discussion about burnout, back before the pandemic, right? One of the things that people were saying is that clinicians needed to reconnect with the meaning of their work. And as someone who had been experiencing burnout, I thought, I know what the meaning of my work is. Like, I know why I want to do this. It's not helping. And so that didn't really resonate with me, and I thought there's something else. I don't know what it is, but there's something else, kinda like you were saying, that's missing. And that was going on around the time that I was doing my master's in applied positive psychology, and I heard Isaac Prelatinsky talk about mattering, and he defines it as being able to both add value and feel valued. And I thought, well, that's it, right? Um, in healthcare, of course, we want to be making a positive difference in the lives of others, right? So that's the adding value. But there's also that feeling valued component. Um, and so then I started thinking about this kind of nonstop and ultimately ended up starting to ask people, what's the meaning of your work? And people could usually tell me that in a very concise way. I want to help others. I want to, um, bring comfort to people and whatever it might be. And then you'd say, well, tell me about a time when you felt like you mattered. And then you would get these rich narratives, and people would tell these beautiful stories about how those moments of connection. And that's when I became convinced that this is where we needed to be looking.
Yeah, there's a there that
Uh,
we need to learn more about because it's clearly a gap that we need to address. And so it's wonderful that you're dedicating your work to this, and look forward to more developments about your research and others. I see how or hear how you're applying that personally as well. So you're doing all this research on mattering. Or how are you making sure you feel that you matter or things are meaningful in your life, and then how you link it to other positive psychology constructs.
oh, well, I think one of the things that I've done is kind of navigated my career towards doing more teaching. And that has been a tremendous boon for me in terms of mattering. When I can see a light bulb go off for one of my students, right, where something that didn't make sense starts to make sense, um, that is just such a high for me, right? Like this idea that I'm helping to bring others along into this healthcare field with us.
Wonderful. And what advice do you have for health practitioners to help them? Is there any practical way they can get this feeling of mattering from their coworkers or whatever role they have? Is it that they have to like ask for some feedback from others, or what does that look like?
Well, the more the more that I do this, the more convinced I am that mattering occurs in the small moments. Um, it's not grandiose gestures, it's not, big flamboyant awards, but it's in those moments where you feel truly connected with another person, whether it is a colleague or a patient. And And sometimes it's moments of gratitude, sometimes it's moments of, shared emotion. Sometimes it's it's just simply knowing that being there is making a difference for someone else. And it's been amazing to me how important it is for us as clinicians to feel like we are doing something to make the lives of others better. I guess that shouldn't be surprising. But, when somebody says, I was talking to a nurse and the nurse said, my patient was distraught because she lost something in her room and she couldn't find it and she was going crazy. And I helped her find that. And then she could just settle down and be healing. And, if you think about all the other amazing things that this nurse did for this patient, with medications and hygiene and all the other things, um, it was that moment of, knowing that she had truly helped this patient in a moment of distress that was the one that stuck out to her.
She truly felt she mattered in a very deep way, made a big difference for that patient.
Yeah, she was able to bring her peace in a moment of great distress.
Yeah. Yeah. So are there other examples or any examples for health professionals in any healthcare role who are in really busy practices in terms of this new construct of mattering, helping their patients to feel that the patients matter in their lives, or how do they nudge them along? So they certainly want to, professionals should be applying it for themselves to help prevent burnout. But clearly, this is an important part of overall well being. So, how do we promote this in our patients?
I think just giving the sense that you care about them as a person, and that you want to connect with them person to person. I think particularly now when not only are you in the examining room together, but there's also a computer and sometimes a scribe and a million other things going on. Taking the time to sit down and say, so, tell me what's going well in your life right now. What is it that is bringing you joy, right? Anything. It can be any kind of question. Tell me about your kids. Tell me whatever it might be, that gives them the sense that you truly care about them as a person and not just a chief complaint or um, another appointment to check off at the end of the day.
Ultimately, it's through some authentic, deep human connection.
Yeah, it really is.
Yeah. How do you see the future of research and practice evolving in this area of mattering?
Oh, I'm not sure how it's going to evolve. I'm hoping that as we start to understand a little bit more about what does generate mattering, um, that we can start to actually do some interventions, right? Ultimately, what I would like to do is to create a healthcare environment where everyone that's part of it leaves at the end of the day feeling more energized and engaged in their work than they did when they showed up in the morning, right? Because if you feel as though the work that you're doing is truly making an impact and what you're doing is valued, then how can you leave without feeling better about yourself at the end of the day? So I think that that's something that is, I think we can do that, right? I just think that we have to pay attention to the things that help generate um, those emotions for us or those senses for us.
It's interesting because, like so many other constructs in positive psychology, a lot of it has to do with redirecting attention.
Mm.
And yeah, and then that makes such a huge difference. Uh, wow. Well, are there any resources? These are early days in mattering that are your favorite resources, articles, books, or even just more broadly, positive psychology resources that you'd recommend for our listeners.
Well, so first of all, Isaac Proletinsky now has a book on mattering. He and his wife wrote it, called How People Matter. um, I find that to be a really accessible and easily readable book. Um, there is another book, and this isn't about medicine, but I think that there are so many really important nuggets in it. A book that's called Never Enough, um, that's by Jennifer Brahenny Wallace, and it's about toxic achievement culture. And I think this idea of maybe we're prioritizing the wrong things. Maybe it's not about getting an A on every test, but maybe it's about going to baseball practice where you know that you're surrounded by people that you care about and they care about you.
Yeah.
So that's a favorite right now. And then I just bought, so I can't report on the book yet, um, Resilient Threads by Mukta Panda. And so she is a physician and she's very interested in well-being. In fact, she even wrote here, I've got a copy of it right here, an oath to self-care and well-being that is available online, and she wants people to use it and spread the word. It's written as a supplement to the Hippocratic Oath and is directing us also to care for ourselves, our systems, our colleagues, so that we can provide better care for our patients. So I'm pretty excited to read that book. I'll get back
That's
to you.
exciting. I'm going to definitely print that oath as well, and we'll link that on our website. We'll see if we can link it on this podcast, because that's terrific. We all need that
Yes. Yeah.
self-care and well-being, and it's that commitment with self-compassion
Mhm.
to take care of ourselves. So, yeah, wonderful. Well, are there other things you would like to share with our audience that we haven't touched on? These are quick podcasts where we just summarize a few ideas, but I don't want us to miss anything important that you want to leave our audience with.
Well, I think I'm just so excited that there's a growing community of people in healthcare who are actually having these discussions. Um, when I started back in 2014, there was one other physician in my class and one other person that had been in a class before me that I was aware of. I think that there were more than that, but those were like the only two people I knew. And so now I feel like there's this growing community of us, people in healthcare that actually want to think about well-being in a much more broad and a holistic sense. And so I think I'm inspired by you and everything that you're doing and just glad to be a part of this community.
Well, thank you so much. Thank you for being on this podcast with us. And one more question. What is your one favorite tool or takeaway message for well-being? What's your favorite piece? There's so much we can do.
Oh, well, so somewhere along the way, someone said to me, every complaint is an unfulfilled wish. And the phrase, what would you like instead? And so it's incredibly powerful in helping people reframe from what they don't want to what they're actually aspiring to. And once you have a common goal, you can work toward it together instead of just getting buried in the what we don't want. So that's been a really fun one to use along the way.
That's I call that positive visioning. So you're getting the details of that positive future that you want, and you can't move towards that positive future unless you have some idea of what that looks like. And so that's a wonderful question to start to answer that question. What does that look like?
Right.
And then we're propelled forward in a positive way. So thank you for that advice and for taking the time to join us on this podcast. And maybe we'll have you back again on another podcast. And yeah, that's Julie Hazlip. And thank you to our audience for following us in this GPHI podcast series. We hope to see you on another one of these sessions. And in the meantime, be safe, be well, and please subscribe to our channel. Till next time, take care, everybody. Bye-bye.